Understanding acute limb ischemia. Acute limb ischemia is a medical emergency caused by sudden blood flow loss. It primarily results from ruptured atherosclerotic plaque leading to thrombus formation. The limb may present with severe pain, difficulty in movement, and compromised blood flow. ECG can show signs of underlying cardiac issues like atrial fibrillation. The 6 P's of ischemia: pain, pallor, paresthesia, pulselessness, poikilothermia, and paralysis. Thrombus formation obstructs blood flow to skeletal muscle, leading to ischemic damage. Embolization often comes from cardiac sources, especially in atrial fibrillation. Embolization often comes from cardiac sources, especially in atrial fibrillation. Other causes include embolization and less common events like peripheral artery trauma. Patients with chronic peripheral arterial disease may have gradual onset of ischemic symptoms due to collateral flow. Poikilothermia, or coldness to touch, is typically present in affected limbs. Diagnosis begins with clinical assessment and bedside arterial Doppler evaluation. Immediate anticoagulation with heparin is critical to prevent further ischemic damage. Urgent interventions like thrombolysis or surgery may be necessary for treatment. In cases of an immediately threatened limb, surgery should not be delayed. Correctly identified stages of ischemia can save limbs and enhance survival rates. Timing is crucial. Immediate action limits the risk of irreversible damage. After revascularization, careful monitoring for complications like compartment syndrome is essential. Reperfusion can lead to injury. Look for swelling and other complications. Understand the differential diagnosis such as cholesterol embolization syndrome. Differentiating between ischemia and compartment syndrome is crucial for effective treatment. Education on acute limb ischemia can significantly improve outcomes for patients. 30-day amputation-free survival rates showcase the importance of timely interventions. Managing underlying conditions like PAD can reduce the risk of acute limb ischemia. Ensuring optimal blood flow post-treatment is key to recovery. In-depth imaging helps determine the necessity for additional procedures. Rehabilitation after limb-saving interventions enhances patient recovery. Rapid diagnosis and intervention are pivotal to preventing limb loss. Regular training ensures preparedness for acute limb ischemia cases. Unified teamwork across disciplines maximizes patient outcomes. Access to guidelines and resources can enhance knowledge for practitioners. Celebrating recovery stories emphasizes the importance of timely intervention. Long-term management and follow-ups are essential for ongoing well-being. Patients should be educated on peripheral arterial disease to recognize the risk of acute limb ischemia. Together, we can navigate acute limb ischemia and promote healing. The 6 P's of acute limb ischemia deserve recognition and swift response. Teamwork amongst providers is essential for managing acute limb ischemia.